Hi, I'm Dr. Scott Sanamore.
And I'm Dr. George Rogu from RBK Pediatrics. Primary care when you want it, urgent care when you need it.
So we just threw this video together for you just before you come in for your 10-year-old's well visit. We just wanted to kind of let you know what to expect when you come on in. Basically, it's been a year since the last time we saw you. So we're going to spend some time catching up on everything that's gone on over the past year, everything at school, at work, any medical changes, any allergies, medications, surgeries, hospitalizations. We want to make sure that we're up to date with everything that's been going on. We're going to go over the growth curves. That's still by far the most important thing that we look at these visits, making sure your kiddos are growing and gaining weight appropriately. Obviously, we'll review the development and academics at school, making sure the kids are performing the way we'd like them to. And of course, we'll give them a nice full physical examination, make sure we're not missing anything here. So the first thing we like to talk about is the physical development of the kids. Make sure we're keeping their bodies healthy here. Well, what kind of advice do you like to give for this, Dr. Rogu?
Well, for physical development on a 10-year-old, these children are little athletes. They need at least 1 hour of moderate to vigorous physical activity daily. Team sports and active play are good ways to get this done. You have to promote activities that enhance their strength, their endurance, and their coordination. And try to encourage outdoor play and exploration as opposed to just letting them go in the living room and play on the video games.
Yeah, we're big fans of the organized team sports at this age. The team sports teach the kids teamwork, discipline, how to be part of a team, how to treat other teammates. It teaches them that if they practice something, they will get better at it. All of these are important lessons that help make life a lot easier for the kiddos as they get a little bit older here. The other part of physical health for the kiddos is the nutrition and what we're feeding them. We want to make sure that we're giving them a nice balanced diet and we're staying away from all of the junk food, all of the kids' favorite foods, the fried, fatty, and especially the sugary stuff. Remember, kids don't need anything to drink except for milk and water. The kids don't do anything with the sugar from soda and juice. It just goes all right on top there. Portion control is also very important also. The teenagers, especially the boys, tend to eat a lot at this age. They're growing and they're burning tons of calories, but they don't need all of those extra calories. One portion, one plate of food is all any of us really need. Sleep, also very important. Well, what's your sleep advice for 10-year-olds?
Well, for 10-year-olds, you have to ensure that they get at least 9 to 12 hours of sleep daily. Consistency of the bedtime, very, very important. Waking up around about the same time to go to school. Don't let them go to sleep whenever they want to, wake up whenever they want to, because that just messes up the whole sleep cycle. And very, very important, they're more active, they're smarter now at 10, they have more gadgets. Make that room a sleep room. Don't allow them to have a TV, a computer, PlayStation, or a phone in the room, because while you may think that they're sleeping, if you leave a phone in their room, I promise you they're not. They're on the phone. You know, 100%. Now they're texting at 10 also. They're on their phone maybe with some friends. They're more sophisticated. Or they're on YouTube or TikTok and just scrolling mindlessly. And they can't sleep and rest. Then they can't wake up for school.
Yeah, it's like a big snowball effect.
Yeah.
Safety. Again, they're 10 years old now and they're doing a lot more on their own. They're out with their friends and stuff like that. Making sure that you continue to reinforce all of the important safety stuff, like wearing their seatbelts when they're in the cars every time, putting that helmet on every time they're on the bike. Making sure they understand the traffic rules, not crossing the street without looking both ways, crossing in the proper places. We were talking about the phones and the internet, the texting. The internet can be a very dangerous place for kids, and kids don't understand why it's a dangerous place for them. So it can be very difficult to protect them. Make sure you're keeping all of the content blockers and filters and stuff like that on the phones. Make sure you're monitoring their social media use. Really stay on top of them with this stuff. They can get themselves into a lot of trouble without realizing it online. It's also important to make sure we teach the kids the safety rules and emergency preparedness, making sure they know what to do when they don't know what to do. Calling 911, the police, the fire department, the doctors, just making sure that they're versed in that. When we talk about the social development, what kind of advice do you like to give, Dr. Rogu?
Well, I like to tell children and parents, you know, they should support relationship, healthy peer relationship with other children and their family. They should have, they should be empathetic to their family members, their parents. They should respect their parents. They should respect other children. And, problem solving skills, very, very important. Let the child figure things out, because if you figure it out for the child all the time, they're going to become adults. And if they cannot figure things out as a child, they're not going to be able to figure it out as an adult when it's more important.
100%.
Yeah.
One other thing that we like to encourage with the kids is to continue to brush their teeth twice a day, every day. Nobody likes getting drilled at the dentist, and that's what's going to happen if they don't brush their teeth. Get them a nice fluoride toothpaste, and schedule them the dental checkups every 6 months. Behavioral modification. So this is all about the balance between encouraging that independence that you were talking about before and making sure that we're guiding them into the good habits and the good advice. Well, what kind of advice and things do you like to give to the parents for this?
You should try to get the children to do independent reading of age-appropriate books and reading materials. You should promote critical thinking skills. And a way to do this is have them do puzzles, games, and talking and engaging in discussion with people, other children, parents, families, grandparents, and so forth. Personal health care and healthy habits, such as, taking a shower. Boys don't like taking a shower. Teach them to take a shower. And, with the girls, you have to try to, get them, sometimes they could have self-esteem issues and body image issues that starts around this age. And this all starts on TikTok and YouTube, and they look at other people that, with all those filters, they look perfect. And sometimes they wonder why they're not so perfect. And it creates things socially and emotionally for these young children as they get older. And it starts now.
100%. I agree with that.
Yeah.
The screen time, one of our favorite topics. We still do not recommend just handing the phones and the tablets and letting the kids just sit on the couch all afternoon with that thing. We recommend 2 hours a day at the most. And we want it to be the high quality educational type. We want them learning something or doing something positive with it. Kick them outside, make them run around outside, hang out with their friends, ride their bikes, anything except for that stupid screen. Family time starts becoming very important as these kiddos start getting to be teenagers. They want to spend less and less time with their family, but family is very, very important for us. It's all we really have in life. So making sure that we're getting the kids to spend time with the family, whether it's board games, family trips, family dinners every night work also. But just make sure that you're spending time as a family with your kids talking. Vaccines at 10 years old.
Yeah.
What do we talk about with them at this age?
The vaccines restart now at 10. In our office, we give the Tdap, the tetanus, diphtheria, and pertussis to prevent whooping cough. We also give in the fall months the seasonal flu vaccine. And at around 10, we also start recommending some routine blood work screening, where we can check for cholesterol, a CBC for anemia, liver function, kidney function test, insulin level, maybe a vitamin D level, and so forth and so on. They may need a PPD for school.
Yeah. And this is just the routine screening stuff just to
Yeah.
make sure we're not missing anything.
Yeah.
So thank you guys for spending some time with us in the video in anticipation of coming in. We're looking forward to seeing you guys. It's going to be a whole year before we see you again, but always remember we are always around for you. We are primary care when you want it and urgent care when you need it. We're around 24/7. We have doctors on call. Call us for anything you need. We're here to help you and answer any of your questions. We look forward to seeing you guys.
Thank you.